We are glad you have joined us for day 2 of the 2024 CDC One Lab Summit. If this is your first day joining us, we're thrilled to have you. If you are coming back after yesterday, we're thrilled to have you too. A couple of notes about today's session. This and all other sessions are being recorded and are going to be posted on the One Lab Summit page at a later date. If you have any trouble or technical issues during the One Lab Summit, please email the One Lab Summit inbox for support at onelab@cdc.gov. We're going to give participants a few more minutes to join, and then we will get started. If you have any questions throughout today's events, please insert them into the questions and answers panel at the bottom of your Zoom screen. We'll answer questions at the end of each session. We've posted the link to live captions in the chat. Please be sure to keep the captions window open if you're using it, in addition to the Zoom meeting window. I'll now turn it over to our One Lab Network lead, Alicia Branch, to introduce today's theme. Alicia?
Thanks, Blanche. Today's theme is planning. We are fortunate to have Ms. Shannon Williams as our distinguished keynote speaker and other subject matter experts again today who are ready to enrich our learning experience. I'll read our disclaimer and then introduce our speaker. Next slide, please. I'll go ahead and just read it. Slide decks may contain presentation material from panelists not affiliated with CDC. Presentation content from external panelists may not necessarily reflect CDC's official position on topics covered. I'm excited to introduce our keynote speaker today. Ms. Shannon Williams is a supervisor, medical technologist, and cross-training coordinator at the District of Columbia Public Health Laboratory with over 10 years of clinical laboratory experience. She joined the DC Public Health Laboratory as a medical technologist and quickly transitioned to several concurrent roles. During the COVID-19 pandemic surge, Shannon supervised the DC Public Health's mobile testing unit, followed by the interim laboratory epidemiology coordinator before accepting her current role. Our keynote speaker for today is Ms. Shannon Williams. Over to you, Shannon.
Thank you for that introduction. I will actually go ahead and skip this since you kindly did that for me.
Go ahead.
And we can get started. So cross-training. Simply put, cross-training is the answer. And most people have actually participated in cross-training at some point in their career. And in many cases, they may not have known that it was cross-training or even recognize the benefits due to how it was implemented. But when it is effectively implemented, it is indeed the answer to the many universal lab challenges that we have all seen or experienced at some point. So definition-wise, and again, this is a little subjective, but cross-training is a powerful training plan lab managers can use to build a reserve of staff to prepare for future challenges, resolve current challenges, and optimize overall lab preparedness. And to quickly list some of those challenges we are all so familiar with, at the top of the list, we have staffing issues, both planned and unplanned, and the bane of every laboratorian's experience, downtime. Then there's surge testing, where we love those high volumes of samples with those urgent turnaround times. And the last challenge, which is certainly not all of the challenges, but the last one that I'd like to talk about is the consistent concern, with onboarding of new staff, which should ideally be completed without interrupting daily operations. But as we all know, that isn't always the case. And I know it almost sounds too good to be true for cross-training to solve all of these issues and common challenges. But it's important to realize that a lot of labs have already implemented cross-training in some way. And the key is to capitalize on your lab's strengths and identify the most ideal method of implementation that works for your lab. And again, as we all know, being able to adapt at any moment in the lab setting not only allows for routine operations to continue without interruption, but also ensures preparedness. And this creates a future-ready team, which allows lab managers to easily maintain stability while also providing flexibility for staff. Now, cross-training, it isn't solely for the benefit of management or operations. It also creates opportunities for career development and job enhancement. And for this, for staff, this can be an opportunity to enhance the skills and knowledge that they already have for professional development, or it could be a chance to develop complementary skills. By cross-training in different units or on different assays within your lab, staff can showcase additional skills their current position doesn't necessarily require, but could potentially open doors for a promotion, such as moving from a processing role into a testing role, or from a testing role into a supervisory role. And while implementation can feel overwhelming at first, once a realistic and actionable plan is established, the benefits will undoubtedly outweigh the cost. And essentially, cross-training can be a lab's greatest tool. And I may be biased, but it truly is the most cohesive approach for addressing both wants and needs in the lab. Now, let's say your lab is as solid as they come. You are prepared for anything and everything. And if that's you, you can keep that to yourself because no one likes to show off. But you would have the ability to utilize cross-training to focus more on those staff wants, such as job enhancement, professional development, and the biggest want of them all, schedule flexibility, which we will definitely get into later. But going back to focusing on professional development, this chart on the screen captures results from a survey that we actually utilized to gauge our staff preferences for where they wanted to be scheduled for cross-training. Now, the first go around for our cross-training program, this was one of the methods that we utilized to get staff interest. And we'll talk more about that later, but a key factor to keep in mind is to coordinate training based on complementary skills as well as lab need. So I'm hoping you're already starting to see that this can truly be a win-win strategy that extends beyond the bench, but again, we'll get into all those details. Next slide. So I'm sure many of you could go the rest of your careers without hearing the words COVID-19 response ever again. So I'll be brief with this one. But like many of you here at the DC Public Health Lab, following the pandemic, we completed a retrospective analysis to identify what had occurred in regards to training, in addition to testing, but more so for our cross-training program. We used this analysis to look at training and how we responded so we could essentially improve our overall lab preparedness. And in that analysis, we undeniably saw that a surge led to increased sample volumes and subsequently increasing turnaround times. Naturally, having a team built around typical routine testing volumes for daily operations during surges, our trainers were required to train and test almost simultaneously because of these surges. And fortunately, training efforts did increase the number of trained staff across multiple units to widen our staff ability to accomplish all the testing that was needed. However, it lacks a concentrated focus on a lot of the pain points that staff were experiencing. And it didn't efficiently address overload and exhaustion, nor did it improve the turnaround time on a consistent basis, which does not take away from how hard everyone worked throughout the entire pandemic. But some of those pain points included those bottleneck steps that sometimes you just can't prepare for until it happens. And when it comes to overload and exhaustion, there were still instances of necessary overtime for many of our staff. And in regards to turnaround times, they definitely improved. However, because we still had issues that weren't fully addressed, and we didn't have the time to address them because of the need for so much testing, those turnaround times weren't always met. Next slide. So when it came to our MPOX response, again, we did the same thing, retrospective analysis, and we're able to see that while the training plan still wasn't the most ideal, there was a noticeable improvement in training efforts, which were based on lessons learned from our COVID-19 response. So with our MPOX training, we were able to double the number of trained staff in less than a month by pooling staff with complementary skills, which significantly improved trainer availability. Given the additional staff that were trained, it freed up our trainers to train additional staff as needed. And we were also able, thanks to the additional staff and the increased trainer availability, we were able to implement a rotating schedule, which allowed us to assign staff to specific days for testing, as well as when we had higher volumes or expected higher volumes, we were able to create a shift within a shift. So we would have a team A in the morning and a team B in the afternoon. And again, this team was comprised of staff across our lab who had complementary skills to train quickly and be scheduled for testing. So when it came to these teams, sometimes for MPOX in particular, we had an extraction team and then a PCR team. And so this allowed us to significantly reduce that overload and exhaustion that a lot of our team was feeling, myself included. And this allowed us to have a sustainable schedule, which improved our overall operational efficiency. Next slide. So we touched on the benefits of cross-training earlier, but we'll go ahead and go into a little bit more detail for that. And I wanted to start with this stool analogy. So when it comes to a stool, you have the legs that support the seat, and you can look at the seat as your lab or a unit or whichever need you have in your lab for cross-training. Now, let's say we're focusing our cross-training efforts on specific assays or specific unit. Well, each of these legs can represent a staff member in that unit, that particular unit. You have one staff member that is trained in 4 out of 5 assays. You have a second staff member trained in 3 out of 5. And then you have a third staff member who is trained in all 5 assays within that unit. Now, if let's say that one staff member that is trained in all 5 assays, they unfortunately have to go on leave, you're left with 2 staff who aren't fully trained on all of your assays, and you're left trying to figure out how to adjust and adapt. So the biggest benefit with cross-training is that it allows for readily available support for critical functions or for all the assays within a unit. This subsequently increases schedule flexibility. So this prevents that overload and exhaustion from staff having to come together and cover all the assays or struggle to do so. And having a readily available pool of staff allows you to decrease the need for overtime for the staff that are coming together to cover those assays. And another amazing benefit of cross-training is that it allows for a PTO-friendly schedule. Cross-training also resolves common operational interruptions and delays, which we will get into. And the biggest benefit, especially for management, is that it increases workforce sustainability, which, as we all know, is critical to a fully prepared and functioning lab. For staff, this can also promote knowledge transfer, which I'm sure some of you have seen in the lab. Sometimes staff can be nervous about knowledge transfer They feel the need that they need to know everything, and they're the only ones that need to know it, when really it's extremely beneficial for the lab for several staff to be aware of all of the testing assays or specific functions. And so cross-training allows staff to see the benefits without feeling threatened, so to speak. Now, cross-training also significantly reduces the occurrence of those assay bottlenecks that I previously mentioned. And just to get into those with this table at the bottom. So for pre-analytical bottlenecks, that will look like accessioning. Which is a unit that a lot of people don't give much credit to, but accessioning is a core function for every lab. That's performing any testing. And with accessioning, that can look like logging samples into your limbs, or if you're in a hospital, redrawing labs, sending out additional collection requests or specimen labeling. Having enough staff that can cover those tasks can be critical, especially during surges, as well as aliquoting. So in our lab, our accessioning unit did assist with aliquoting, and at some points they were performing all of the aliquoting for our units. And one of the benefits with cross-training was for staff to see just how important of a function that was, and how critical our accessioning unit was to our lab. And obviously, it's pretty self-explanatory when it comes to increasing the amount of staff available to complete that. But the more people available, the faster it gets done, and the less likely people are to burn out. Now, inventory, which we all have to focus on, this one can be broken down into levels. And we won't go into all those levels, but monitoring onboard reagent levels can be a critical function that can be not overlooked, but not focused on. And so you could have staff that are cross-trained in a schedule specifically for checking onboard reagents if you're performing around-the-clock testing during surge testing, or you're short-staffed. And so you can easily have a schedule implemented where you have lab assistants or certain techs in your lab that are checking for those onboarded reagent levels to ensure that it's ready to go for testing to prevent any delays or interruptions. This can also include, if you don't have to worry about onboard reagents, it can also include sample racks, which was something that we also saw, or consumables that are necessary to complete testing. And while these tasks can seem a little bit tedious, they can have a substantial impact on efficiency and exhaustion during surge testing. And that is obviously something that we utilize cross-training for to improve. And with everyone's favorite, days of short staffing, those are also the days when you want to make sure you have some of those critical functions such as inventory or aliquoting and accessioning. You want to have enough people available to cover that. Now, when it comes to some of the analytical benefits, that can look like batching samples. You could have batching schedules where you have some staff that are available that are specifically assigned to batching samples in the morning. That way your testing staff doesn't have to worry about batching and testing. You could have staff that are cross-trained specifically for reagent prep. You can create a schedule specifically for monitoring reagents. And I cannot stress this enough. If you are going to utilize schedules for specific tasks, such as monitoring inventory levels or monitoring anything that has to be utilized for testing, you want to ensure an efficient method for tracking and communicating this information. So you want to make sure everyone is aware of these levels, they're aware of what's going on, they're aware of the schedule, and you want to have an efficient method for doing that, which we'll also get into. Now, for some of the post-analytical benefits, once testing is already completed, this can also be a bottleneck step, especially if, let's say, you're experiencing surge testing and you only have one analyzer. So this could look like a bottleneck step for sample storage. You want to have dedicated roles to ensure timely and accurate storage. You want to have, so this could be another function that you cross-train available staff for to assist if this particular unit was short-staffed or experiencing surge testing. You could have a schedule for this function as well, which would alleviate that stress and overload on the staff from having to go through all those pre-analytical steps or analytical steps and then have to worry about a post-analytical step such as sample storage before moving on to another batch of testing. And again, this also, is important because this can help with potentially with avoiding losing any samples. If staff are overwhelmed, they're running around, they can easily misplace samples or forget where they might have left off. And so this again assists them with being able to be more in control of that testing. Next slide. Okay, so when implementing a cross-training program, here at the DC Public Health Lab, what we did was we utilized this 6-step process in order to figure out the best way to implement our cross-training program. And going back to our first implementation, we utilized the retrospective analysis that we conducted for both our COVID-19 response and our MPOX responses. However, the second go around, we decided to implement this 6-step process to avoid some of the issues that we encountered, which we will get into. But to go over this, and if you want to take a screenshot of this, we won't go into all of the details, but you want to start with, these core questions are where you want to start when you are planning out your program. And you want to start with, what are the needs for your lab? Is there a general need? Are there specific needs for a particular unit or multiple units? And this can be as simple as just needing to increase available staff for certain assays or tasks like we just went over. Or it could be to improve your current schedule. The next question you want to consider is what needs to be prioritized, right? And this needs to be specific. This is not, when you're looking at what you need to prioritize, you don't want to generalize this because you want to be able to measure, how effective your plan is. And without identifying where you need to start, you can't benefit fully from implementing cross-training. And again, this can wear down your staff. They could lose interest, and that is obviously something that we don't want. And the next question to keep in mind is, how can you implement this? What does a cross-training program look like for your lab? Because this is specific to your lab. Every lab is different. And you also want to look at what you're already doing that will complement a cross-training program without interrupting your daily required tasks. And what you're already doing can include something as simple as a huddle or meetings. And you could utilize this since the staff are already used to it or your management is already used to it. You can capitalize on that since they're already familiar with that process. But the purpose in identifying these things is to ensure smooth implementation. Now, the biggest hurdle when it comes to cross-training isn't quite the actual training. It's usually a bit of staff resistance. And we will go into more detail on that in a bit, but that is a critical step that you'll want to put quite a bit of effort into. And while it can be easy to just focus on the training aspect, you can't optimize training until you effectively address any resistance that you might be facing. And by answering these core questions, planning out what is needed for each step in building a solid cross-training program becomes almost effortless. And now just to quickly go over these 6 steps that are displayed here. The first step is assessing your needs in your lab. And that can, again, look like start with identifying critical functions, identifying those pain points within your lab or your units. You want to identify limiting steps. And these points allow you to create a baseline of where you need to start. The next step would be to define your goals based on your needs assessment. And then you can move into designing your plan. And once you have your plan fully designed out, which you definitely want to make sure you focus on your timeline. And when I say timeline, I mean an effective timeline and a very realistic timeline. You also want to look at your required resources, and that's something that you want to have ironed out before you start. And so the next step would be to implement your program. And again, with implementation, that can include managing resistance. It can include pre-training motivation, as well as monitoring and documenting progress, which allows for continuous improvement. So once you've been able to implement your program, you want to move into evaluating your results. And this is something that you want to consistently do. Now, this can look like surveys. This could be done through huddles and meetings with your training staff. But you definitely want to consistently monitor your results to ensure that you're on the right track. And lastly, you want to sustain your efforts. And this can easily be just by integrating cross-training into your lab culture, as well as considering updates based on your lab needs and staff needs. Next slide. So just going into a little bit more detail quickly about all those steps. You're starting with your needs assessment, right? So here we go back to our trustee stool analogy. Now we see that we have enough staff in our unit. However, all of the staff aren't trained in all of the assays. And while that may work with daily operations, at the key point to keep in mind are those times when you're short-staffed or those unexpected times. So first and foremost, we want to identify overall need first, and then identify areas of the lab that would benefit from cross-training. And again, one thing to consider and plan for is that cross-training may be needed in an area, but might require a not so simple process to implement. And so those are things that you want to take the time to plan out. Now at PHL, with our most recently implemented cross-training program, we focused on one unit at a time. And by focusing on one unit, we were able to focus on that complicated process that this unit required, which was compliance oriented and required special clearances. And by assessing the unit needs, we were able to look at the workflow. We were able to identify the limiting steps, the testing bottlenecks, and understand if we could continue any current solutions that we were using for any undesirable outcomes that we were constantly facing, or we were able to identify the need to create new solutions. Now, staff concerns most likely will always include burnout or just not having enough staff to run specific assays. And again, if we look at our stool analogy, that can definitely be the point that could be your critical function that you need to focus your cross-training program on. And again, this can look like focusing on specific functions or an entire assay, but you really want to hone in on where your cross-training efforts need to be focused. It isn't always optimal to focus on every aspect at the same time. You really want to prioritize where you need to start. Next slide. Okay, so defining your goals. You want to base your goals obviously on your needs assessment. And I'm sure many of you are familiar with SMART goals, but this can be the best way and most efficient way to do so. It allows you to stay on track with the needs assessment that you completed, and it allows you to create realistic, actionable goals. So you want to be specific, and you want to ensure these goals are specific to your lab's needs. And this includes both staff needs and testing needs. You want your goals to be measurable. You want to ensure that you are utilizing efforts that allow you to efficiently measure your progress and allow you to make any changes as you go along. You want your goals to be realistic. I know you can be, I know that I can be a bit overzealous at times when it comes to identifying goals, but you really want to be realistic to ensure a successful implementation. And next, you want to make sure your goals are relevant. Do your goals align with your lab values and your mission statement? Do they align with how your daily operations typically run? And lastly, you want to make sure your goals are time-based. You want to set realistic but ambitious deadlines, and this can clarify task prioritization, right? As well as demonstrate the benefits of cross-training. If you set these goals and you have a realistic deadline that you are meeting, this will subsequently increase motivation and staff cooperation, which undoubtedly is necessary to successfully implement a program. Now, when you're looking at your expected results, you want to focus on increasing available staff for a specific assay if your issue is increasing the number of trained staff. And if with your goals being obtainable without interrupting current operations, this allows you to prioritize where you're going to start. And going back to your schedule, if improving your staff coverage plan is your priority, you want to account for short staffing on any given day, right? You want to account for maintenance days. You want to account for conferences if that is a requirement within your lab or a staff desire. But in order to obtain those goals, you want to ensure you're not placing any additional strain on your staff in order to meet these. So again, that goes back to ensuring you're prioritizing and defining sustainable goals. So just to go back, I know we were touching on staff goals, but just to go back on testing goals really quickly, a lot of times when it comes to testing, turnaround time is the priority. And when it comes to turnaround time, that obviously there are a lot of factors go into that. But the number of staff trained and competency assessed for a specific assay, or certain steps in the process. This can include those pre-analytical, analytical, and post-analytical examples that we discussed. And again, if your priority for cross-training is testing, that is where you want to focus at first, if that's a priority, and then you can move into your next priority. Next slide. So designing your cross-training plan. Again, you want to make sure your timeline is achievable. Are all of the units and staff on the same page? Does your cross-training schedule align with the current operational schedule? And I know sometimes when you're trying to plan out a training plan, it can get lost in the sauce, so to speak, and when you get overwhelmed, right? And you want to make sure that you want to prioritize your operations. You don't want to allow cross-training to interrupt what you have going on, because this is, again, how you lose your staff interest. Now, the next point when it comes to your timeline, that is something that we needed to refocus on with our second go around of cross training is the allotted time frame. We want to make sure that it's appropriate for training. Now, the first go around, we were a little overzealous with it, and there were times when we didn't meet those deadlines. And so this second implementation, by focusing on one unit, it allowed us to meet all of those deadlines, which again created interest from our staff. They wanted to cross train. They did not feel overwhelmed. Our trainers did not feel overwhelmed. And one of the ways, as you can see on the screen, one of the ways that we were able to do that, to ensure that, was by sending out a survey to our unit managers. And we wanted to double check first before creating the schedule. We wanted to collaborate with them. We wanted to double check that our cross training plans aligned with their daily operations. And so by giving them this ownership in the plan, it allowed us to easily collaborate and implement a plan that had almost no resistance from our unit managers the second go around. Whereas the first go around, we kind of just shared what the plan would be, and without considering the manager's concerns or needs. Now, when looking at required resources, again, you want to look at your available training staff. You want to look at your staff coverage for trainers and the trainees units. You don't want to schedule a training for cross training if that's going to cause their unit to be short-staffed, right? You want to ensure that your trainers aren't going to short-staff their unit by focusing on training a cross-training tech. And quality assurance is a big factor when it comes to training, as we all know. So you really want to make sure you are planning out what that looks like for your lab. You want to ensure if you need to create any modifications to your training checklist or your competency documents, that you are taking care of that before implementation. That way, once you start with your training, you have all your documentation ready to go, and that is just one less thing to worry about, and you can continue with a smooth implementation. Now, prerequisites and criteria, that's essentially just, you're looking at trainee experience and skills, as well as trainer experience and ability to train, which is a big one. Not everyone is able to train, and that is okay. So you really want to ensure that your trainers are comfortable with training. They know how to train, and they know how to assess a successful training plan. They want to be able to see where there are issues if they need to focus on specific points to ensure successful training for whoever is training in that unit. And lastly, the feedback and support mechanism is also an important factor when designing your plan. How are you collecting and assessing this feedback, right? And again, that also for us, that also looks like a survey. So we sent out a survey to cross-training techs, and we also checked in with them weekly. So we utilize huddles, and we utilized these surveys and they were simple questionnaires or just conversations weekly to check in with our cross-training staff. And this allowed us to ensure that we were on the right track, that our schedule still worked with their home unit, so to speak, and that we were still meeting those deadlines and goals that we had set for our cross-training program. Next slide. Okay, so when implementing your program, the first step is always, well, not always, but the first step usually is managing resistance. Sometimes this is a foreign concept, so to speak. It's something that your staff or management aren't familiar with or used to, and you want to ensure that they are fully supportive of this program because staff buy-in is critical. You want to allow unit managers and trainers to participate in the planning process. And again, that could look like sending out a survey to gauge where they are, to gauge their concerns, to gauge the available timeframes that will work with their unit to host another staff member for training in their unit. And you want to actively solicit this feedback and monitor progress throughout to ensure that you are modifying your cross-training program to consistently align with the unit operations where the cross-training is occurring. You want to prepare your trainers. So this can look like just explaining the process from start to finish, as well as clarifying what their role and required tasks will be. And this can be documentation, resolving any scheduling conflicts, communication, and you want to address all concerns before implementation. And again, when we go back to staff buy-in, showing that you are readily addressing concerns, and that is also a priority in conjunction with training, will allow your staff to feel comfortable with moving forward. It allows them to want to participate. And when you're addressing these concerns, again, this can look like pre-training motivation. You want to use this time to build anticipation and to build interest. And lastly, you want to monitor progress and document continuously. And again, we went into this, but this can include utilizing key performance indicators to allow you to monitor performance. And so you can actively see what is working, what is not, are you meeting your goals? Now, when you're monitoring progress, maintaining training checklists that are modified for your cross-training program can be extremely beneficial. It allows you to have a clearly defined tracking system, and it allows you to see where you are meeting your marks, as well as where you might need to make some modifications. And this can also be simply done with a logbook or some sort of register, right? When you're checking in with your unit managers and your trainers or your trainees, you want to have some sort of centralized location where you are documenting any communications, any issues that were resolved, because this allows you to continuously improve your program as you go along. Next slide. So when it comes to creating a schedule, you want to keep it consistent. The first go around, this was something that we kind of modified as we went along, whereas the second go around was significantly improved. And as you can see on the screen, so what we utilized this time was our Outlook calendar. And so what we did was whenever cross-training was scheduled for a specific team member, we would send out a calendar invite to their unit manager, their unit supervisor, the trainee, and the trainer, so that everyone was on the same page and aware of when cross-training was occurring. And we utilized the same times on the same days. Now, we had to stick with 2 to 3 hour windows across 2 to 3 days weekly. And while that doesn't seem like a lot of time, we were able to accomplish every training goal that we had identified. We broke down our training program to focus on a specific workflow, and we were able to break down that workflow within these training windows. And again, we were able to do this by collaborating with these unit supervisors and managers to stick within the ideal training windows that our supervisors told us that worked with their unit. And next, we established an efficient mode of schedule dissemination. And again, that is this Outlook calendar. It was simple, it was easy to follow, and it sent out automated reminders. So it avoided that instance of the schedule not being shared with everyone. And again, it aligned with agreed upon timeframes, and we stuck to those timeframes. So that also made it easier on us to ensure that all aspects of the training program were being implemented on the days that they were supposed to. Now, there were days when we had to reschedule due to staff being out or unavailable. And because we were utilizing this efficient and digital mode of following the schedule, we were able to easily move the training programs, the training session to another day, or sometimes to another time on that same day. And that was simply by checking in with the supervisors, managers, trainers, and the trainee. And next, we want to focus on evaluating results, right? So when it comes to evaluating your results, you want to ensure continuous evaluations are occurring. You want to, and in order to make any modifications as you go along to make it a little bit easier, again, short weekly huddles or Teams meetings are an ideal way to accomplish this, right? It avoids having to think back on what happened, or potentially miss any issues that or concerns that might have been brought up. And again, you can easily do this by collecting and analyzing your data. And this can look like comparing your projected training numbers to what your actual training numbers are, or looking at your training and competency document completion, right? Are you meeting your deadlines? What issues are occurring? And by collecting this as you go along, and having these short or long weekly huddles or meetings, it allows you to address it as it happens. And again, you want to make sure when you're looking at your cross-training goals, if you are not meeting any of your goals, you want to look at the corrective actions that are being implemented and if they are effective, right? Because if they aren't effective, this can cause your program to be brought to a halt, or again, it can become overbearing on your staff. And again, when it comes to collecting feedback, you want to, next, can you hit next? Thank you. And next one more time. Perfect. When it comes to collecting feedback, you want to assess participant satisfaction, right? Again, cross-training, while it's beneficial for improving your lab preparedness, you want to ensure your staff are satisfied with the program in order to ensure smooth implementation. Did your trainers feel adequately prepared and supported? Did your trainees feel confident in their abilities to perform newly acquired skills? Are your unit managers and supervisors satisfied with the implemented training schedule? Again, these are all points that you want to keep in mind and constantly improve on, which is easily done when you're continuously collecting feedback and addressing these concerns. Next. Okay, so once you've implemented your program and you see that you are on track for meeting your goals, and you've successfully completed your first program or your first version of it, right? You want to sustain these efforts. And that can look like integrating cross-training into your everyday operations. This allows for continuous improvement. This allows for preparedness, which was the overall point in cross-training, right? And by highlighting the success, this allows you to integrate it into your lab culture, right? And examples of highlighting success can look like the number of staff that are attending conferences. Again, if you're unable to allow staff to attend conferences that they'd like to attend for professional development, and cross-training efforts have allowed that to occur, that is something that you want to highlight. That is something for your staff to be proud of, right? Another example of success could look like an increase in PTO approvals. And it can also look like, it can also be demonstrated through a decrease in the number of callouts, right? Staff are human, if they're constantly overworked or feel exhausted, they call out. That's something that we can't avoid. However, when you cross-train and you prepare for this, it decreases the need for staff to call out. They won't feel like they need to. They won't feel overwhelmed or exhausted. And another way to sustain your efforts, and again, this can be subjective, but you can reward your staff for their efforts, right? And this can be as simple as an award for your trainers for their participation and their dedication. And I'm going to tread lightly with this one, but it could look like lifting schedule restrictions or limitations. And I say I tread lightly because a previous job, we were limited to one person per day, no matter what, for PTO, which took a toll on our staff, myself included. But if after implementing cross training, you're able to allow a fully flexible schedule, which increases the amount of people that are able to take PTO, this can be a huge success that will reinforce staff interest and cooperation. And next, excuse me. And again, going back to our trustee stool analysis, once you have your readily available reserve of staff that fill those gaps that you've identified in your needs assessment, you have a fully covered unit, right? You, no matter what the case is, whether you're short staffed, whether you're surge testing, by preparing for anything that could come up, it allows you to operate in the most optimal way and efficiently. And proper reinforcement yields optimal preparedness. Next slide. And just quickly, this is just a look at a schedule that we created following cross-training within one of our units. Now, you could have, and this is just an example, but this was a way for us to easily plan and disseminate a schedule that all of our units that had staff that had cross-trained in this unit, they were able to see when their team members were scheduled and they could work around it. And we could also make any necessary changes as needed and just disseminate this to everyone that needed to receive it. Next slide. Essentially, that is cross-training in a nutshell. I do apologize for all the issues that we encountered, but I did want to, and I know I kind of breezed through it, but I did want to end it with a quote by Jim Krapko, and it said, "If you continue training the same way you've always trained, don't expect to get better results." And this is something that we kept in mind for this second go around of cross-training, to remind us that it's okay to make modifications. It's a continuous improvement is only beneficial to our lab preparedness, which was our optimal goal. So I want to thank you all for your patience and your attendance to this, and I can answer any questions.
Thank you so much. We'll take a few minutes to answer as many questions as possible. If we do not get to answer your question today, we'll do our best to respond via email. If you didn't submit your question anonymously, if you have any questions after today, please feel free to email the OneLab inbox at onelab@cdc.gov. So let's see what's first question. 2 issues. Okay, this person says they have 2 issues that I have seen come up with cross-training is people have not wanted to be trained or they want to be trained, they want to be compensated for the extra work that they have to do now with their already heavy workload. The other issue is staff not wanting to train or be patient with staff who are learning. How did you handle these issues?
Okay, so with the first point, compensation was definitely a big point that was brought up. And I think what we decided to move into, as opposed to kind of hammering it into the staff's brains that, oh, this is for the benefit of the lab, you should just want to do this because you work here. What we had to do was compromise, right? And again, for staff, a lot of times that can look like, while compensation isn't always something that can be modified, unfortunately. But how you can compromise is what all staff would like is PTO, right? Cross-training can allow for a more flexible schedule, which again, when you're short-staffed or when people just need a break, when you have a readily available pool of staff that are cross-trained, anytime anyone needs a break, they can easily take that break, without having to sacrifice the break that they need because there isn't coverage. And for the second point, can you remind me the second point?
Oh, they have it when, so I guess it's the trainer doesn't have the patience to train the staff who's the learner.
um, Another valid point. And again, I think to reduce the instance of that happening when you're scheduling or assigning staff to a unit for cross training, you want to make sure that you're assigning them to a unit that's complementary to their skills. Or if it's not necessarily complementary to their skills, it's a new skill that they are ready to move into. And again, going back to that pre-implementation motivation, support your trainers, discuss what the plan is going to look like, cover any potential issues that they may run into, again, which can be having patience, remind them the benefit that cross training will bring to them and their unit. And again, just support them throughout the process. Have an open line of communication and create an environment where they feel safe for bringing up these issues. And just honestly, collaboration and compromise are the two biggest factors for pretty much any concern when it comes to cross training.
Okay, let's see. The next one, see. I'm assuming they meant I'll say, are there any functions in your LIMS that makes cross-training difficult or you hit a bottleneck with? How can LIMS assist with cross-training and more efficiency?
Can you read that again?
They have lists, but I don't remember you LIS. But I don't remember you saying anything. I remember you talking about your LIM system, so I'm assuming they meant maybe the LIM system. Maybe they'll type in what they meant by this question. Let's go to the next one. They want to thank you for the presentation. They would like to know how you identified staff eligibility for the cross-training program.
Sure. So one of the ways that we were able to do that was by looking at the assays that we were going to focus on for cross training. And we wanted to identify staff who might have had previous experience on a certain instrument or a certain part of the process that we were going to focus our cross training efforts on. And if it was a staff member who necessarily did not have that experience, they may have had similar skills, or they had skills that were essentially a prerequisite to what the cross training was going to focus on. So again, you want to look at complementary skills, but you also want, if that's not the case, you also want to look at those prerequisites. You want to make sure that the trainee is ready to learn that new skill if it's new, as well as the trainer being able to identify the readiness of that trainee and modify the training plan as necessary.
Okay, let's see the next one. Is it better to try and develop a trainer or to move on to another person to do the training?
Oh, that's a dicey one. I think supporting your trainers is always going to be the most ideal option, right? If you've already identified this person to be a trainer, right, and to ensure interest and in collaboration and support for your implementation, for your cross-training implementation, you want to support them. If they are struggling with that process, see how you can help, see why they are struggling. It may not be a skill issue. It may be something different that you can support them through. They may just need a confidence booster, or they just may need some ideas that are that help them think outside the box, or just a little bit of assistance to identify the best workflow for whatever the circumstances are. But again, I definitely think that you should always start with supporting them. And then if you identify that support isn't necessarily enough, rather than just replacing them, I think you work with them to figure out the best method. Maybe you can assist them by having an additional trainer. They work with another trainer, but you definitely want to always support them first. If you do need to find a new trainer, find a way to still include that first trainer if they are still interested in doing it. Because you definitely don't want to discourage anybody.
Right. This is a good one. They thank you again for the presentation. They're just curious to know, how would you support a staff member that would like to cross-train from the bench to a leadership role whenever there is an internal opportunity with an open position?
That's a good one. I think to support, so while that's not all, depending on the organization, that's not always an option, right? But that could look like, introducing them to online, like e-courses, right? To learn leadership skills, to learn how they can assist their supervisor. They could take on more responsibility. And again, I know compensation is a big thing, but if this is a staff member that really wants to progress and move up, sometimes, I've done this personally, sometimes you have to give a little bit to get what you want. And again, for my experience, which is why I brought up the e-courses, what I did while moving into a supervisor role wasn't always a possibility. What I did was I assisted my supervisor with certain responsibilities and certain tasks, which again helped assist, it significantly enhanced my professional development, and allowed me to move into a supervisory role.
Oh yeah, they did mean their limb system. Okay, this wasn't the same person. Hold on, just a minute. We found another one. This person wants the quote.
Oh, they want the quote at the end?
Yes.
Oh, sure. It was by Jim Krapko, and his last name is spelled Krapko. And the quote was, "If you continue training the same way you've always trained, don't expect to get better results." And I think this is I chose this quote because it was a great reminder for both managers and staff, but more specifically managers, to remember, you have to collaborate with your staff. And if you have a management style where you typically just tell the staff what to do, it can be to your benefit in allowing them to have some sort of ownership in the planning or the process. And again, you can control that, but it can be very beneficial to changing the way you implement your training.
Yeah, I think this one's a good one. When you have cross training where staff revolve every 6 months to a year, wouldn't it be difficult to constantly cross train when staff with consistent staff turnaround?
Definitely. And in that instance, that is a bigger problem. However, you want to, before you can even implement a cross-training program, you want to focus on why that staff turnover is so short. What is causing staff to leave? Why aren't they staying? What can you do to encourage them to stay? And again, if you need cross training in order to fill those gaps when staff are leaving, again, that starts with identifying why staff are leaving. What is causing them to leave? How can you prevent that? How can you prevent more staff from leaving? And how can you fill those gaps without overloading your current staff that are staying? But again, that's a bigger problem.
Yeah. We'll take one more question. And I think this is a good one. This she's actually a LIMS manager. And she said, how do we cross-train or select a tech to train where at work it might be seen as favoritism or pre-selection? So did you experience any where people felt like there was some favoritism in the person that you were choosing?
I don't think we necessarily faced the issue of favoritism. But I think, well, for this question, when evolving around limbs, again, you want to consider any prerequisite skills. You want to look at complementary skills. Um, and again, let's say you have a staff member who doesn't necessarily have those prerequisites or skills, and they actively would like to cross train on your limbs, right? Start with, you don't necessarily have to count them out, right? You can start with getting them familiar with those prerequisites in order to eventually cross train in limbs while you're focusing on someone who currently has those skills. And so you're not discounting them. You're focusing on that cross training need for your limbs while also still providing an opportunity for others who may not necessarily have the prerequisite skills, but you're still assisting them with getting to that point.
I want to thank you so much for sharing your experience and knowledge and passion. It definitely shows how laboratories can actually, use this same plan to develop their current staff and to address the laboratory workforce shortage. And also plan for future public health threats through cross training. So thank you so much. And I look forward to seeing you again.
Absolutely. Thank you so much for the opportunity. It was an absolute pleasure and honor. And again, thank you for your patience.
Oh, you're welcome. Back to you, Blanche.